Readings of the day. Today we have a very special guest with us, that is Dr. Sneha Divekar ma'am. She has graduated from GS Medical College. She has done a basic NDT course with many advanced courses offered by the NDTA organization in the US. She has also completed sensory integration courses. She has done few neuro-adult related courses as well to apply to the pediatric population. She is the founder of Chetna Rehabilitation Center, which is a multidisciplinary pediatric therapy center in Thane since 30 years. We welcome you, ma'am.
Thank you. Thank you so much for the introduction. And we get started immediately.
Yes.
Can I share the screen?
Okay. Yes, ma'am.
Yes. Okay. So here we are. As I was introduced, I run this Chetna Rehabilitation Center, which is a multidisciplinary center for pediatric neuro rehab. We have various services offered here, physiotherapy, speech therapy, occupational therapy, everything under one roof for cerebral palsy, as well as autism and all other related neuromuscular diseases. I am giving this background about where I am working and why we have this today's topic. Today's topic is importance of holistic development, importance of holistic approach in the development of child with cerebral palsy. So now we have been treating children with cerebral palsy, and I have since I'm working since 30 years, I have actually seen them growing from their babyhood to their adulthood. So that's why I chose this topic about holistic development. The goal is to, before we start with any client, we do goal setting, right? In any physiotherapy with any physiotherapy client. So to develop each child with his or her disability to the fullest potential, make him or her as independent in life as possible, and to increase the child's participation in the society. Now, let's have a look at the WHO model of disability. Around 16% of global population currently experience significant disability. So the disability results from complex interaction among all these titles which are displayed in the slide just now. So the body system, the child with disability or the person with disability, cerebral palsy is in the center, his condition on one side, and the body system's integrity and impairment, which happens due to the neurological damage which occurred at birth. So that body system is impaired and its integrity and impairment is on one side, which ultimately affects the motor functions. So the motor functions can be effective and ineffective. It ultimately leads to individuals' activity limitations. We all know that the children develop compensations, correct? We keep talking about compensations. So these compensations are the motor functions which can be effective or ineffective, leading to the limitation of activities. Ultimately, this leads to social participation restriction, and the environment also can be a barrier or a facilitator, correct? So all these different aspects around the person interact with each other. The interaction is very complex, and this leads to the development of disability. What I mean here is that environment and culture they have a huge impact on the experience of disability and the extent of disability. This I am talking about apart from primary affection due to neuromuscular condition. Okay, so increasing social participation of the person with disability is the key to his fullest development, which is the goal as stated in the previous slide. So that is why the importance of holistic approach. When we talk about importance of holistic approach in the development of child with cerebral palsy, a life course perspective is needed. As I said earlier, I have seen children growing up from babyhood to their adulthood. So I know that it is my first-hand experience to see how the life course develops as the child grows older and older. So a life course perspective is needed. more children live into their adolescence and adulthood. So more and more children are living into their adolescence and adulthood, the challenges with the same amount of disability go on increasing. We have a dearth of participation opportunities in our society due to various reasons. Let me ask you, how many of you have seen a child with quadriplegia or a child with diplegia walking around you in the society or in the society premises, on the roads or in the malls? Hardly, isn't it? In spite of all the awareness created in the last few years. So, this dearth of participation opportunities is very challenging in our society compared to the Western world, obviously. A family-centered approach is needed. Why is a family-centered approach needed? Because we have a vast socio-economic strata. Children with cerebral palsy are coming from various socio-economic backgrounds. So they or they can come from rural areas or they can be in the metro cities. So the challenges faced by a family which is located in the rural area are different than the challenges faced by a family who comes from urban area or a metro city. So a family-centered approach is very important. Now, the last and the most important point is carryover into function. What I mean by carryover into function is that whatever we are working on, whatever is our goal, that goal is achieved. When that goal is achieved, it must transform itself into the function which is related to the child's life. And this is, according to me, the most difficult part of the whole journey. What I mean by this is that, say, for example, a child with diplegia starts walking inside the clinic or the hospital room, inside the clinic or a hospital. So that ambulation should get transformed into walking at home, walking in the society his building premises, walking or ambulating independently in the school premises, and ultimately everywhere. This is what I call carryover into the function. And if the child is able to walk, then the child must be able to work with his hands and walk. This is something called as carryover into function. And that is the most difficult part of this whole journey. So this is all about importance of the holistic approach. Now let's look at how do we plan a goal for holistic development. Now, as soon as we take the name of physiotherapy, we all know we have to optimize mobility. We have to, I'm not going into the individual system impairments which occur due to cerebral palsy. I'm straight away going to planning a goal for holistic development. So we have to optimize mobility, manage the primary condition, of course, prevent and manage the complications occurring due to the primary condition. We have to maximize the independence, enhance social and peer interaction, foster or facilitate self-care as the child starts growing older and older, maximize his ability to communicate. Because unless and until he communicates, his social and peer interaction is not going to improve. Maximize his learning potential, and ultimately, this whole will lead to enhancement of quality of life. Now, when I say quality of life, what do I mean? I mean quality of life for the child or adult with cerebral palsy himself and his parents and the whole family of that person. Let me give you one example. Let's say a child with, say, a girl who is around 25 to 30 year old. So she has a big body, correct? Body mass is huge. She is GMFCS level 4. So when I start treating her, I have to remember that I have to increase her social and peer interaction. Let me go to the next slide. Okay, so for this particular child who is 25 to 30 year old, she is GMFCS level 4. So she walks with the help of a device, say for example, walker, and with lot of difficulty, she is walking with her hand held by the mother. Now, her mother is also in her 50s, the child is also older. So for change of quality of life. The mother is unable to carry the child outside home without the help of walker. And with the, as we discussed the NDT model, with the dearth of opportunities in our society or in our premises, it is very difficult to go out with a walker. So if we remember this, and while setting the goal, if we work on the child in such a way that the handheld mobility improves, so it becomes easier for the mother to take the child out for walks, or maybe sometimes they can go to the malls to enjoy the mall. And we haven't changed the GMFCS level, right? The GMFCS level remains 4. That we never moved the child to higher level before 4. But though the level remains same, we had a particular goal of working on handhold mobility at least for few steps, so that wherever there is hindrance, she can cross the hindrance by holding hands, and then again maybe go on her walker for ambulation in the premises. Now, let me talk a little about importance of play when we are talking about participation. For a young child who is 2-year-old, 3-year-old, 5 or less than 10-year-old, 10 to 12 years old, play is an integral part of child's life, isn't it? And cerebral palsy poses very difficult obstacles to play activities. So we at our center look at play from functional perspective. What I mean by this is that you have to find out that how much is the child allowed to play, or does the child play in the society premises or with his peers or with his friends. Is he playing? Or if he is not playing, then what is the participation limitation that is happening for play? So looking at play from functional perspective, and here I'm talking about both directed as well as non-directed play. So both directed as well as non-directed play must be encouraged. Looking at play from functional perspective and working on specific things which will facilitate his play. It can be anything. You have to talk to the child to find out that what is important for that particular child. Let me give you an example of one child who was around 9 to 10 years old. And when we were talking to him, he told me that during recess in the school, all his friends keep climbing on one wall, which was a few feet tall, with their hands pushed behind the wall. And they used to push on their hands and sit on the wall. And he said that I don't get to do that because I am unable to push with my hands and feet to climb on the wall. So this is what I say, directed play. And when we looked at this play, which he described from functional perspective, we worked on that particular function, and he was able to play with his friends. So this is what I mean by looking at play from functional perspective. So when we talk about holistic development, we have to, when we are looking at holistic development, we have to have the central goal of rehabilitation as shown in the slide. We have to promote the child's participation in the significant life's context. Now here, for a 10-year-old child, his life's context was playing in the recess with his friends. Correct? So that was his life's context. For a child who is, for a girl who is around 25 to 26-year-old, her life's context will be independence in the house. And when I talk about independence at home, I mean she should be able to work in the kitchen. We should not be just happy with she standing independently. She should be standing close to the kitchen platform, operate the mixie, or cook with the stove in the front, because that is the significant life's context, and that's supposed to be her participation related to her life's context. That is what I mean by promoting in the significant life's context. Now, priorities and needs of the child from the perspective of the parents or caretakers are also important. Here, what I mean is, we had a family. The child has quadriplegia, but he can ambulate very well on a four-arm walker. Now, his grandparents used to feel that he has grandparents from both sides who are interested in taking care of the child. So here, the grandparents were unable to, move the child because he was so difficult to move. So their need was that they wanted to participate in taking care of the child. So we devised a walker on which we provided a support which the grandfather or the grandmother could push through. Since I am unable to share the video of that particular child due to permission issues, but the grandparents were so happy that they were able to take him down in the society premises, and with the help of walker, the child was able to roam around. So this is what I mean by priorities and needs of the child from the perspective of caretakers. And it has to be meaningful and appropriate to the family priorities. What I mean by this is that, say a child comes from a lower socioeconomic class where the mother and father and everybody in the home, everybody at home goes out for working. Or a child who comes from an affluent family who has a servant who looks after him 24 hours a day. So here the goals of the families or the family priorities are going to change, are going to be very different. So when I set my goal of rehabilitation, I have to remember that it has to be meaningful and appropriate to the family's priorities. And also we have to, from time to time, we have to evaluate changes in the performance and satisfaction as reported by the caregivers. So this is about central goal of rehabilitation, keeping in mind holistic development of the child. Now, let's look at this slide. What I mean by holistic development. So for holistic development, 1 minute. Okay. What I mean by holistic approach, we have child with cerebral palsy in the center. The three sides of the triangle are representing body systems, functional activities of the child, and posture and movement. We all know posture and movement are affected in cerebral palsy, right? In body systems, all the body systems are involved most of the times, but they will be involved to various extent. Like the severity of the affection is going to be different with each body system. For example, the nervous system will be the most affected body system. The musculoskeletal system is also affected, but the other systems like sensory system, the gastrointestinal system, arousal, attention, all the body systems are involved, and that to a various extent, which is very challenging. Their interaction becomes very challenging in the view of presentation of symptoms. Then we have functional activities. We already spoke about functional activities related to the life's context of that particular person. Now, the triangle is contained in the square, which has four sides. One is characteristics of the child. What I mean here is the nature of the child. Is the child introvert? Is the child extrovert? Is the child interested? Is the child curious? What is his cognitive level? So all those are characteristics of that particular child or the person. Then on the other side, we have the family. So family, is it possible for the family to spend their resources on the rehabilitation of the child? How much can they, in terms of money, in terms of time, in terms of efforts? How involved is the family, or practically how much is possible for the family? That becomes my family aspect. And also their backgrounds matter a lot. On the other side of the square is culture. So culture, what by culture I mean is that how is their outlook towards looking at disability? How do they look at the disability from their cultural point of view? Also, in our culture, we have so many support systems, such big support system around the child that hardly a child with cerebral palsy lives alone in India, isn't it? They will have somebody or the other looking after them. But as compared to that, in the Western world, the culture is different, and children with cerebral palsy are also expected to live alone on their own as they grow into adulthood. So this is what I mean by culture. And then on the other side, we have the intervention team. So what are the views of intervention team? Who are the members of the intervention team? How is the dialogue among the individuals in the intervention team? This is what I mean. This is the meaning of holistic approach, that we are looking at the child as a whole. We are looking at him from his life's contextual perspective. We are looking at family, we are looking at intervention team, we are looking at everything from a bird's eye view. Now, as I said before, environment and culture have a huge impact on the extent of disability as well as the experience of disability. Correct? Now, let's move to the next slide. Now let's look at, we now discuss that why holistic approach is needed and what is the meaning of holistic approach. Now let's look at practical or real life issues related to diagnosis of cerebral palsy. The extreme variability of clinical presentation in cerebral palsy. On one side, we have a child with gross hypotonia who is all floppy, unable to lift his head. At the other extreme, we have dyskinetic cerebral palsy or athetosis or involuntary movements who are just moving too much. So this is variability of clinical presentation. Then we have very spastic children also, and we have a mixed picture also. So the extreme variability of clinical presentation is a big challenge for the therapist to set her goal. The next is complexity of the affected function. As we already discussed, the various body systems are affected, and that too at various levels. Like, one system can be affected more than the other system, and depending on the complex interaction among the system leads to the symptom presentation. So it all increases the complexity and challenge for the physiotherapist to set her goals for that particular child. The lifelong existence of disability. As the child grows, the increasing age increases the challenges faced by the individual as well as the caretakers. The physical, social, psychological development variations related to the life's context. As the age increases, the life's context also go on changing. A child who is just diagnosed is very young, maybe baby, then pre-primary, then primary, he goes to school. So the dilemma of special school or normal, typically developed school for typically developing children. So this is how the life's context go on increasing. And as they reach adulthood or adolescent, those are again different challenges related to a different life context. Now, it has heavy impacts on the whole family as a whole. It is an impact financially, the impact is also emotionally, and the impact is also psychologically and also physically. It takes its own toll on the whole family as a whole. So these are some practical or real life issues which should be remembered while we are setting goals for that particular child for holistic development. This is just a small slide which shows that a child with diplegia also has a lot of writing issues, isn't it? So we will go into the details of this 4-year-old child with diplegia. Now, since the diagnosis is diplegia, the motor issues will be a typical presentation of diplegia. But when we did sensory profile, we saw a lot of sensory seeking behaviors, low endurance, hypersensitivity, sensory processing issues related to visual, vestibular, oral sensory systems, modulation of body position and movement in space. So along with his motor issues, he had heavy sensory system issues. Correct? This is what I mean by overlap of motor and sensory systems. Now, because sensory processing system was affecting the emotional response, since he was hypersensitive, his emotional response was different to the sensory input. Ultimately, this affects the behavioral response, and this can lead to a pseudo impression of cognitively low responses, when in reality the child might be cognitively good. So now let's look at sensory issues in cerebral palsy. So we all are aware that all systems are affected, and it is very important to be watchful for the sensory issues in cerebral palsy. They can have sensory regulation issues. So at one time you see one picture and at the other time you see another picture, and you just wonder that is this the same child? The child will be different on Thursday and the child will be different on Saturday. So this is what I call sensory regulation issues. They can be hypersensitive to sensory input, so they will show avoidant behaviors. They are scared. They have low tolerance to sensory input. Like a child may not perform very well in a crowded clinic with lot of noise coming around, or he may not be able to focus with so much visual stimulation in the crowded clinic. So they are hypersensitive kids with sensory system impairment. They can be hyposensitive, so they will have decreased arousal, low responses, giving the again pseudo impression. There can be specific deficits in the particular sensory systems like visuoperceptual issues, tactile issues, oral sensory system issues. So if the sensory issues in cerebral palsy are not identified and focused on along with the motor issues, it can take a lot of cognitive effort and can slow down the whole developmental process. So much is the importance of sensory issues in cerebral palsy. So what do we do while setting the goals? So we include the occupational therapy and remedial educator in our intervention team. We all are aware about fine motor functions, isn't it? So fine motor functions are very important for activities of daily living. They are important for handwriting. So many children with cerebral palsy face handwriting issues. So we follow the program based on handwriting without tears. We specifically work on the hand of children with diplegia or whatever goal you decide for that particular child through therapy. So involvement of occupational therapy is very important. Hemiplegias are a special group of children with cerebral palsy. They have different presentation, and most of them are going to be with the typically developing children. We have to remember this, that the children with hemiplegia are going to be with kids who are normal, typically developing. So early intervention and identifying system impairments and prioritizing them becomes very important for every child with hemiplegia. So as and when support of a remedial educator is needed should be given, especially in the early years, to facilitate learning and writing. Special educators can become a link between the school or the school counselor and parents. So important is remedial education. So now let's go to speech therapy and communication and oral motor skills. So in cerebral palsy, there is a lot of primary impairment, right? So all the primary impairments obviously affect the respiratory system. Secondary impairments and atypical patterns of movements restrict stability and mobility of the rib cage. So the quality, the duration, the pitch, rhythm, loudness, and rate of phonation all can get affected because of affection of the respiratory system. So the graded exhalation needed for speech sounds or the air pressure support needed to produce speech sounds is affected. So all this is going to restrict my adequate breath support for sound production, and also the coordination among the respiration, laryngeal functioning, and oral motor activity. So the dialogue, let me go to the next slide. So it becomes utmost important to have teamwork between the speech therapist and the physiotherapist. So the speech therapist and the physiotherapist must work hand in hand to work on the respiratory system and sound production. A simple postural correction can make sound production very easier. So, if the postural correction is needed during speech therapy sessions, it should be provided. Like we have to have a look during the speech therapy sessions to see that is the posture right? Is the posture giving me optimal positioning of the rib cage so that it will become easier for the child to produce sound or to focus with his eyes or to follow instructions of the speech therapist. So a simple postural correction or suggestions for postural correction can make the session easier for the speech therapist as well as for the child. Getting a child say yes or no changes the world for that child and for that family. So instead of waiting for the full words to emerge or for the full sentences to emerge or a clear sound to emerge, we can just use some gestures as suggested by the speech therapist to make the child say yes and no, because that is going to make his life easier and his caretaker's life easier. So a simple work on extrinsic facial muscles. All physiotherapists must remember that extrinsic facial muscles are also affected in cerebral palsy, giving a flat effect on the child's face. So as soon as you start working on the extrinsic facial muscles, which are the most ignored muscles and easy to respond muscles in cerebral palsy, it will change the effect on the child's face, and that is going to change the happiness on the mother's face, obviously. Also, working on oral sensory issues leads to reduction in feeding time, which gives a great relief to the caregivers or the mother. Say, for example, a child is fed, say, 4 times in a day, and each feeding time, each feeding session is, if it is going to take 1 hour for a child with quadriplegia, imagine spending 4 to 5 hours just feeding the child by the caregiver or the mother. It must be so exhausting. So before you start working on the major motor issues of the child, it becomes very imperative to work on the oral motor issues as well to reduce the feeding time and give some relief to the caretaker or the mother. We all are aware about the importance of augmentative systems and use of technology. Nowadays, a lot of apps are coming up like Avaz and all. So they are very important for augmentative communication systems and improving the communication with the child with cerebral palsy. So this is how the teamwork of speech therapist and physiotherapist becomes very important in the child with cerebral palsy. This is just an example to show you that this was a child with dyskinetic cerebral palsy. We just added weights to her extremities, we stabilized her, and her speech therapy sessions became very easier for the speech therapist. Now, let's look at some real life examples. Let's relate to one child case scenario with all the interventions. Now, let's look at a child who is 6-year-old with diplegia. So, since she has diplegia, she will obviously have gross motor issues, fine motor issues. She also has attention issues, motivations, classroom support is needed. So, since she is cognitively very good, she is going to go to a normal school. She is going to go to a normal school, isn't it? So, a support or a focus on her fine motor development, on her attention, motivation, and giving her a classroom support becomes very important. Life's perspective is writing a few letters can change the family's outlook towards the child and the school's outlook also. Life's perspective is needed. Life perspective is very important for deciding long term and short term goals and the outcomes before setting the goals for that particular child. We have to remember that this child who is just 6-year-old right now is going to go through different life's context and is going to grow, and his age increases, the challenges are going to grow. So depending on that, we have to decide our long-term goal with the holistic development in the mind. Now, when the child reaches adolescent, it becomes very important to discuss with him his difficulties which he is facing, because now discussing with his caregivers is not important. Discussing with himself becomes very important. For example, we had to discuss with a child. We had to discuss with a child his difficulties and accepting a writer for his exams, though he was doing very well cognitively, or his writing speed was good, but still we had to convince him to accept a writer to increase his performance in the school. We had a 9-year-old girl. Let us take example of this 9-year-old girl with dyskinetic cerebral palsy. She had very good cognition. Obviously, gross motor, fine motor, everything was affected, but she was very, she used to not cooperate at all. So, because cognitively, it took us some time to realize that her cognition is excellent. So, by increasing her oral motor exercises and increasing her sessions with the speech therapist, reduced her resistance by using different play techniques and doing oral motor and speech therapy sessions before we could start with her gross motor sessions, reduced her resistance for therapy, and that's how we got her into cooperation mode. 14-year boy with spastic hemiplegia. Now he is growing up, correct? He's become tall now. His body is very strong. So for him, we have to change his gross motor function exercises. So we started using treadmill, cycling, and playing with his peer group, which changed his outlook towards his disability. And again, he started taking interest into his rehabilitation. Now, another important part is transition to adulthood. Now, journey for preparation to adulthood starts as early as 14 years of age, or for some, it might just start after 10 to 12 years of age. So they are charged with the same functions as others, isn't it? They are going to go into the same society where we all move, and they are going to be charged with the same functions, and a lot of physical movements are involved. For example, going alone by auto or going alone by bus, or helping, or even if the child is moving with a caretaker, helping the caretaker as much as possible with physical movements. So lot of confidence and social skills are necessary for transitioning into adulthood, and the physiotherapist team or the intervention team also should be aware about transitioning into adulthood. Now, when we talk about adulthood, I feel that the key to transition to adulthood is compensate and modify. When the individual or the child himself starts understanding that I have to compensate and modify, his transition to adulthood has started. For example, one young girl with diplegia told me that when she told me that I am unable to stand very still at one place for more than 2 minutes. So I have to move. That was her, she knew, she was aware about her problem. So she told me one day that whenever I have to take pictures or photographs with my friends, I go against the wall and I am reclining against the wall, or I make sure that I have friends on my either side. So she learned to compensate and modify her standing while taking photographs. This was beginning of her transition to adulthood. So how can we help them transition into adulthood? Obviously, therapy is going on, your gross motor issues are going to remain, and we go on changing them as the child's age increases. But we can organize, we at center organize a lot of workshops. We ask the older kids to volunteer, organize, and assist in their own capacity. So by doing this, the younger kids can see them as an examples to transitioning into adulthood. And this is how it helps them a lot. Instead of advising, just looking at them helps the younger kids to understand that, okay, this is the same child who used to do therapy with me, but look at him, he is organizing a workshop now. So this is how organizing workshop helps. Group sessions with occupational therapists can help a lot. I also do a lot of use emotional intelligence techniques to help the child, talk to them, help them transition into adulthood, help them deal with their emotional issues, or help of a counselor is also needed many times. So all in all, what I want to say is that for holistic development of the child, or keeping holistic development into our minds, we need to create conducive environment for development of that child. So what I mean by conducive environment is that we have to conduct workshops and give them more and more information. We conduct workshops and camps with art and craft. We also have parties and fun workshops, because ultimately happiness is very important. And I am very proud to say that my center has become an informal support groups to many, many families and children with special needs. So we also look at parental issues of posture and pain. This again, creates a lot of awareness in the child about his family, caring in the child about his family. So this is how a conducive environment is created for holistic development of the child. So this slide is very important for me. I feel that this is how the stages of goal setting or stages of treatment should go while we are treating a child with cerebral palsy. So we do therapy things to the child. We do therapy things with the child. They do things in life which we encourage as a team, and they get to choose. I would conclude my session with this slide about holistic developmental approach while treating cerebral palsy child.
Yes, ma'am.
I hope I was slow and I tend to talk very fast, but I hope it was understandable.
Yes, ma'am. Absolutely.
And clear.
It was a very, very informative session. Thank you so much.
Thank you so much for giving me this opportunity.
You're welcome,
Glad to see you all here. Thank
Yes.
you so much. Thank you so much.
Yes, thank you, ma'am. I would also like to thank Dr. Parag Sancheti, sir, our chairman, Sancheti Group, and Mrs. Manisha Sangvi, ma'am, who is the chairperson of Sancheti Healthcare Academy. I would also like to thank Dr. Apurva Shimpi, sir, who is the principal of Sancheti Institute College of Physiotherapy, our PHYSIO TV team, and technical support. Thank you, and see you all in the next session.
Thank you so much.